Today's October 28th, 2017. We're here with Dr. Ramsayer from Ghana, Africa, who came all this way, thousands of miles, to learn about ozone. You're a medical doctor, and you are a gynecologist.
Yeah.
And can you give me some thoughts on what you experienced and learned this weekend?
It is tremendous. This program has actually opened us to a new era of medical practice. We know that drugs cannot do everything, and even if they do, they don't do everything in everybody. But this is an alternative medicine, which is worth that we should start trying it too, because it holds an excellent future for mankind. So we need to support it.
Thank you. Were you surprised at what you saw? Were you surprised that...
I was surprised because it was doing wonders within a short period of time. You just give an injection of ozone to somebody, and within some seconds, the pain is gone. And it's surprising.
Good, thanks.
Surprising.
You guys are going to start doing this in Ghana, correct?
Yes, straightforward.
And I'm really looking forward to collaborating with you, as is my friend Dr. Robbins.
That is wonderful.
So we
are
will
always welcome. Also, we are going to set up a center, and then we will first of all start with injections, and then when we are able to get the ZS machine, then we can Zatzman machine. Then we can progress further.
Very good, thank you. I'd like to post this on YouTube. Is that okay with you?
Yes, you can.
Thank you. I'm very proud that you guys from Africa would come here to train with us. And I hope you found the training very good.
Yes, please. Thank you very much. Thank you for speaking to me.
Today's date is October 28th, 2017. We're here with Pat, who's a nurse practitioner from St. Louis. And she came to our quarterly oxidation workshop, ozone workshop. And I'm just asking her for a report on what she thought. Was it worth it? Did you learn anything? What do you think?
Absolutely, it was worth it. I'm so much farther ahead in terms of what I know, what I can take back to my patients. I learned techniques that I didn't even know existed, save time, energy, and materials. I think people will benefit by me being here and taking the time. Dr. Rohn and Dr. Sue are excellent teachers, very kind. I appreciated everything they said and how they set up the whole event. I would recommend it to anyone.
Thank you, thank you. Was it worth it financially too?
It was worth it financially, and I have to say that as a nurse, I was watching Dr. Rohn do a bloodless IV insertion, and I was impressed.
Thank you very much.
You're
I'd like
welcome.
to post this on YouTube. May I do that?
You can.
You also had a condition yourself.
Oh, yes.
Can we see that?
Sure. I had a lipoma on my right elbow, and it's been there for years, and we just shot it with 33 gamma ozone, and it's about half the size. It was not painful, but the size has gone down by 50% in one day.
In a day. I'm impressed too.
I'd do it again. I'd recommend anybody do it.
Thank you so much.
You're welcome.
One last thing before you go. You have done gravity ozone.
Yes, I have.
What are your thoughts on that now compared to what you saw with what we do, the hyperbaric method?
Hyperbaric is so much more effective. You get so much more ozone into the body. There's a lot of effort with both, but you might as well, if you're going to spend time with the patient's going to spend money, I would definitely recommend the 10 pass. And it takes a little while to learn, but I imagine it's like driving a car or riding a bike. Once you get it, you get it.
I hope we were good teachers too.
You were very good teachers.
Thanks. Well, this is the 28th. This is the end of our workshop. This is Dr. Brian, a naturopath from Palm Springs. Can you give us a comment on what you thought the value of this workshop was to you?
Yeah, it was tremendous. I think the ability to come down here and see a machine and see some people that are really comfortable doing ozone, particularly 10 pass, and explaining it to you and walking through it is immensely valuable. I couldn't imagine doing this without having seen it done multiple times and gotten, some hand holding through the process and then seen it again. Like you can't replace that. You can't replace that kind of tutelage.
Would you value the training that were you happy with the quality of the training?
Completely. Thrilled actually. This was perfect. It was a great course.
Good. And you've been doing ozone for how long?
A couple years now.
Okay.
Yep.
So you learned
all
things,
single pass.
all single pass. So
Until
you
now.
learned things you've never seen before.
Absolutely.
Okay.
Yeah.
I presume
Single
you'll be
pass.
doing it.
We plan to. Yeah.
Okay, thanks. May I post this on YouTube?
Absolutely, you may.
Thank you very much.
Of course.
Today's October 28th, 2017. We're here with Dr. Al Manash, who's a very impressive dentist from Southern California who does implants and bone buildup, and he's here for our ozone class. And I wanted to ask you what you thought about the class and what we did for you.
Well, thank you for having the class. I learned a great deal about ozone therapy and how it's used and how it can treat people with difficult issues. And I want to thank you for sharing all the experiences and all the information that you've gained over the years. And you gave us a lot of insight about what ozone therapy can do for people. And I was lucky enough that you tried it on me because I have lower back pain, herniated disc, and both of my knees hurt. So you injected my lower back and both knees, and they both feel a lot better. So thank you for helping me.
Thank you very much. And with a herniated disc.
Yes, with
And
herniated
it feels
disc.
a lot better.
Yes,
And
it
it's
feels
only
a lot
been an
better.
hour.
Yes.
Thank you very
Sure.
much.
Thank you for sharing all this information over the last 2 days. It was a great deal of information. It's nice to go through the course and learn all this.
Thanks.
You don't get exposed to this kind of information anywhere else. So, thank you.
Well, I hope we were good teachers to you. And
Yeah.
I'd like to post this on YouTube if I may.
Sure, that's fine.
Thanks.
You're welcome. Thank you.
Today's the 28th of October. This is the second day of our 2-day workshop. We're back with Dr. Julian Holmes and my Sierra Leone blood brother, Dr. Howard Robbins. You have had 4 DIV, direct
Yep.
intravenous ozone gas treatments since yesterday, correct?
Yeah.
And when we first saw you, you could barely do anything.
I struggled. Well, no, I didn't struggle. Without either one of your assistants, I couldn't actually move. I mean, it really was that bad.
And I remember we went to a restaurant the first night, and I needed to hold you up just to
Yep.
wait for the car to pull up, and you
Yep.
were walking with a cane.
Yes.
Ozone World, a master. You're a dentist. What are your thoughts on what you experienced yourself with this man's DIV treatment?
We have a lot to learn.
Would you have believed it?
No.
Wow.
I'll be,
Tell me more.
be quite honest with you. I had read about this. I expected changes maybe after maybe a week, 2 weeks. I was completely unprepared for almost the immediate change. And for me, it's my immunologist actually summed it up very nicely. He said, you've gone from 100% to 0%. And it's going to be so nice to go back to this guy and say, well, actually, Robert, I'd like you to have a look at me now. What do you think now? And my cardiologist, I don't even want to begin to speculate what he might or might not say. He was very ambivalent about me coming because I discussed it with him. My wife, I think, was very afraid that it was going to kill me.
The ozone would kill you.
Yeah. She said, her comment was, well, you're putting all this gas into you. Don't you think it's slightly dangerous? And I said, sometimes you have to believe in what people are saying, and you have to believe that miracles can happen.
Well,
And,
I saw a miracle here because I saw you the other night, and you needed my assistance to walk 30 feet from the restaurant door to get to the car. And now you got up off of that chair without any assistance.
Yeah.
And while I can believe it because I do ozone all the time, I'm really pleased that just 4 simple DIV treatments did this for you.
It's certainly, I'm going to get very emotional now. I never expected to get well. I had kind of reached a point in my life where I'd accepted that was the way I was going to be. And all I can really say to both of you is I love you guys, because you've shown me that, okay, I may be considered to be a dental expert in ozone. I know so little in comparison. So thank you, both of you.
Thank you. And I have both of your permission to post
Oh,
this. Is that
please,
correct?
yeah.
Absolutely.
And a comment from you also. You're a world master of ozone. It's known. What were your thoughts on our weekend workshop? Honestly.
I would like to come and spend a week with you at some stage. But I've got a lot to learn, and I would love to be able to take that information and actually teach it in South Africa. So part of what I'm doing with Howard is learning the hows, the whys, the wherefores, what to look for, what not to look for, to take that back, put it into a form which potentially dentists can further help their patients. And try and emphasize the point to these guys. We are not just dentists, we're healthcare workers.
You're treating the whole body, and most dentists
Exactly.
don't know it. And you saw
Yeah.
what I do with my muscle testing, and I'm in your mouth.
Well, I've done that part before, and yet you forget it
Mhm.
because you don't use it on a daily basis.
I do.
Yeah.
And I'm not a dentist.
Exactly.
Is this a course you'd recommend to doctors? You've been to ozone courses for doctors and dentists. What are your thoughts there?
Can I come again, please?
Okay. Thanks.
Brilliant. I mean, it's been inspirational. I've seen miracles, not just with myself, but with the course attendants, where we had one gentleman who was in such pain they couldn't straighten their finger, and yet the following day he's moving his hands without any pain whatsoever.
That's right. I forgot about that.
I've seen people here who have hobbled for their life because of problems with their feet, and between the two of them you've made it easy for them to walk, and you look at them now and you think you're not the same person. And I've watched the skeptics who've been here say, and you can tell they're sitting on the fence, and it's like, wow, I hope that those people use ozone. I really do, because ozone has a part to play, irrespective of what our professional bodies and governments may say. Ozone is medicine, and it works 100% every single time.
Thank you, Julian. I appreciate it. Dr. Robbins, I thank you too.
I'm more than happy to have done what I could do.
I love it when you come, and I hope you'll keep coming to the workshops.
Every time you have one.
Very good.